Good morning po to our media partners and to all our viewers live via Facebook and YouTube. And welcome to the DOH Beat COVID-19 Media Forum for today, Monday, September 6, 2021, to give us the latest updates on the COVID-19 response and other public health programs of the Department of Health. Here is the DOH official spokesperson and Undersecretary, Yusek Maria Rosette Vergere. Magandang umaga po, Yusek.
Good morning, Lindsay, at magandang umaga po sa inyong lahat. Ngayong araw po ay Lunes. Happy Monday po sa lahat. Welcome to our media forum. So patuloy pa rin pong tumataas ang kaso ng COVID-19 sa ating bansa at this very crucial time that we are gradually opening up our economy. Kami po sa Department of Health ay muling nananawagan sa sama-samang pagkilos upang mapigilan ang pagkalat ng sakit at mapanatiling ligtas sa COVID-19 ang ating mga sarili at ang ating mga mahal sa buhay. Dapat po tama ang pagsuot ng mask at face shield. Hindi po kwintas ang face mask at hindi rin po headband ang face shield. Hanggat maaari, iwasan po nating hawakan ang ating mga face mask. Kung kailangang hubarin ang face mask, alisin ito sa pamamagitan sa paghawak sa ear loops o dun sa tali sa tenga. Yun po ang hahawakan nyo pag tinatanggal nyo ang face mask nyo. Palagian po tayo magugas ng kamay gamit ang tubig at sabon o gumamit po ng alkohol. I-disinfect ang mga bagay na laging hinahawakan. Manatili po tayo sa bahay, maliban lamang kung may mahalaga po tayong gawain sa labas ng bahay. Kumain po tayo ng masusustansyang pagkain at uminom ng maraming tubig para lumakas po ang ating resistensya. Agad po tayong mag-isolate kung nakakaranas na po tayo ng simptomas ng COVID-19 o alam po natin na na-expose tayo sa isang positibong kaso. Agad po tayong tumawag sa mga telemedicine providers o di kaya tumawag sa ating local government unit, yung kanilang barangay health emergency response teams, para matulungan po kayo kung ano ang inyong gagawin kung sakasakaling nakakaranas na kayo ng simptomas. Huwag po kayo mag-aalinlangang sabihin sa inyong close contacts ang resulta ng inyong COVID-19 test para mapigilan na po natin ang patuloy na pagdami ng mga kaso sa ating komunidad. Siguraduhin po natin na maayos ang daluyan ng hangin kung tayo po ay nasa loob ng bahay. Buksan po natin ang ating mga bintana at pintuan para tuloy-tuloy po ang pagdaloy ng hangin. Magpabakuna na po tayo kung pwede na po tayo at hikayatin din po natin ang ating mga kamag-anak, ang ating mga kapitbahay para magpabakuna. Libre po ang bakuna. Magparehistro lamang kayo sa inyong local governments. At kumuha po tayo ng totoo at tamang impormasyon mula lamang sa mga valid sources ng information. So ngayong araw po, I will be providing pertinent updates on our biosurveillance efforts, our COVID-19 situation, and the critical action points that must be in place moving forward. Next slide. Nationally and some regions shows a slowing down in increase in the number of cases. However, the national case classification and health systems capacity remain to be at high risk. Majority or 95% of provinces, highly urbanized cities, and independent component cities remains to be flagged under alert levels 3 and alert level 4. More than half of the regions still with high risk health systems capacity, and majority, about 82% of flagged areas have high-risk health systems capacity. Cases may still continue to increase in the next weeks due to higher transmissibility of the Delta variant of concern, and as we continue active case finding in our areas. So we should implement strict granular lockdowns, we should shorten the interval between detection and isolation, and we should enforce the compliance to minimum public health standards to cut community transmission. We should also strengthen our triage and referral systems and be able to augment healthcare capacity to safeguard healthcare capacity. And lastly, we have to ramp up priority vaccination to protect the vulnerable population. Next slide. Next slide. So of the 11,132 samples sequenced assigned with a lineage as of August 27, 24% of samples were positive for the beta variant, 21.5% were positive for the alpha variant, and 16% were positive for the Delta variant. 0.02% were samples positive for the Gamma variant. Next slide. Among all the sequence samples in the Philippines, 62% of the 11,132 samples with assigned lineages positive for the Alpha, Beta, or Delta variant. All regions either have an Alpha or a Beta variant, while 16 regions have Delta variant cases. All NCR cities were found to have a variant of concern, as well as 513 or 61% of the returning overseas Filipinos. Next slide. As of September 5, 2021, the total reported confirmed cases is 2,080,984, of which 7.57% are active cases, 90.79% are recoveries, and 1.65% are deaths. Looking more closely at our active cases, 97.91% of these are either asymptomatic, mild, or moderate cases, and 2.09% or 3,292 cases are severe or critical. For September 5, the top 5 regions contributing to the new cases being reported are the National Capital Region, Regions 4A, 3, 1, and 7. The top 5 areas contributing to the new cases are Cavite, Laguna, Rizal, Quezon City, and Bulacan. Next slide. Confirmed cases shows a steep increase and has exceeded the 7-day moving average. Our epidemic curve shows a new peak every week since the second week of August. Cases from August 30 to September 5 recorded 18,292 cases per day, an increase of 1,779 or 11% cases per day compared to the previous week of August 23 to 29, which was at 16,513 cases. As the cases increased, the National Capital Region, the dark blue bars, Region 7, the orange bars, Region 4A, the teal bars, and Region 3, the yellow bars, and Region 6, the violet bars, continue to show increase in proportion. Next slide. Disaggregating our epidemic curve into the major island groups and the NCR, plus, we have noted that all areas are showing an increase in the number of cases. NCR and plus areas, the dark blue and the green lines, as well as the rest of Luzon, which is the red line, are showing a steep increase. Visayas at a plateau, while Mindanao exhibiting continued increase in cases. Next slide. Nationally, we remain to be at high-risk case classification with a positive 2-week growth rate at 32% and a high-risk average daily attack rate, which increased to 15.79 cases for every 100,000 population. A decrease in the 2-week growth rate is seen nationally and in 7 regions, which are the NCR, Regions 4A, 3, 10, 1, and 7. Region 7 now has a negative 2-week growth rate. The national ICU utilization rate remains to be at high risk. 9 regions have high-risk health systems capacity. We would like to flag the National Capital Region, Regions 4A, 2, CAR, 3, 10, 1, 11, Caraga, 6, and 12 with high-risk case classification based on its moderate risk 2-week growth rate and high-risk average daily attack rate. The NCR maintains positive 2-week growth rate and a high-risk average daily attack rate and is currently at high-risk case classification. ADAR increased from 25.61 in the previous 3 to 4 weeks to 33.60 per 100,000 population in the recent week. Next slide. In NCR, the 7-day moving average shows continuous increasing trend as cases in the recent 7 days have exceeded the previous 7 days by 574 cases. So we now have an average daily reported case of 4,974 in the National Capital Region. Next slide. All of the areas in the National Capital Region have positive 2-week growth rate and high-risk average daily attack rates and high-risk case classification. The regional health system's capacity is at high risk, with ICU utilization at 74%. 16 areas with high-risk health systems capacity ranging from 70% to full utilization. Districts 2 and 4 with high-risk beds and ICU utilization, while District 1 has high-risk bed utilization. All areas except the City of Manila are classified as Alert Level 4. The Delta variant of concern had been detected across all areas in the National Capital Region. Next slide. This table shows the classification of all provinces, highly urbanized cities, and independent component cities into their corresponding alert levels as of September 5. Areas highlighted in pink have detected Delta variant of concern cases in their localities as of August 27 run. Next slide. At the national level, deaths had been increasing since the last week of July, and a new peak was seen during the previous week with incoming deaths report. This number is still expected to increase. Evidence here as well is the increase in deaths in Region 3, the violet bars, in Region 4A, the teal bars, and in Region 7, the orange bars. Their contribution to the total number of deaths is seen to be increasing in the past week. Next slide. The average deaths per day in August of 2021 is now at 131, nearing the deaths last April of 2021. Partial data for September show an average of 40 deaths per day. We are closely monitoring Regions 3, Region 7, NCR, Region 4A, Caraga, Region 12, 1, and 10, as these are the regions which posted the highest total deaths for the first week of September. Its average daily deaths also show an increasing trend since August of 2021. Next slide. So given these numbers, here are our key actions for this week. First, strict enforcement of minimum public health standards, especially in areas or activities included in the 3Cs framework. And these are areas which are closed or not well ventilated, those that are crowded, and those that can permit close contacts among different individuals inside that place. Second is active case finding and immediate isolation in granular lockdowns. Third, ongoing augmentation of health systems capacity and transfer of asymptomatic and mild cases to community facilities. Fourth, continuous monitoring of cases and healthcare utilization for adjustments in policy and response. Next is continuous implementation of border control restrictions and policies, continuous coordination among the national and local governments, and continuous provision of up-to-date information to the public. So that is all. Over to you, Lindsay.
Thank you very much, Yusek. I will now be going through the questions sent to us by our media partners. First question from Jenna Balaudo. The IATF has lifted the travel restrictions in the 10 countries, including India and Indonesia. Hindi po ba masyadong maaga na i-lift ang restrictions lalo't hindi pa bumababa ang mga kaso?
Pina-follow natin, Jenna, yung ating classification for this risk classification ng countries. We have adopted yung CDC guidelines. Nung sa CDC guidelines, meron silang classification ng mga countries as to high risk, moderate risk, at saka low risk. So we have adopted that since, I think that was 4 weeks prior to this lifting of restriction. Aside from the CDC, dinagdagan pa namin yung ating parameter kasi para mas meron tayong leeway for countries kasi masyadong mahigpit yung naging parameters ng CDC, and almost all countries na pupunta dun sa mga high, moderate na risk classification. So nilagyan pa ho natin ng isa pang metric para po mas maiayos natin, and this is the incidence rate ng ating mga kaso ng COVID-19. And doing that, nung nakita natin, napunta na po, because of the CDC classification, yun po mga dating restricted dito sa ating bansa, katulad ng India, ng Indonesia, ng Malaysia, nag-improve na po ang kanilang sitwasyon base sa assessment internationally, at ito po ay napunta na sila sa mga moderate risk level na mga countries. Kaya po na-lift yung restriction nila And as I've said, we have adopted that. Pero hindi naman po natin kailangan mag-alala dahil may mga safeguards po tayo. Hindi man natin i-restrict ang isang bansa, meron po tayong strict border control kung saan lahat po ng mga dumadating na travelers ay nire-require nating mag-quarantine. Wala po tayong exemption. Kahit humanitarian, hindi po natin pinapayagan unless merong emergency medical condition. Pero aside from that, everybody goes through our 10+4 quarantine and testing on the 7th day.
Thank you very much po, Yusek. We have several questions regarding yung mga granular lockdowns po. Hihingi po sana ng details sa meeting ng DOH at Metro Manila Mayors last Saturday. Ano-ano daw po ang mga rekomendasyon o mga bagong strategy na ipatutupad sa granular lockdowns? And with the implementation of granular lockdown system in NCR, mawawala na po ba ang community quarantine classification at least sa Metro Manila?
Yes, no? So unang-una, gusto ko lang ipaabot sa inyong lahat na ito pong guidelines na ito ay ipapatupad, i-approve pa no, ng IATF. So aantayin pa ho natin yung decision na yon bago tayo makapagbigay ng full details of this implementation. Ito pong nai-propose po ng Data Analytics Group. Ang Data Analytics Group po is a sub-TWG of IATF. Ito po yung nag-aaral ng mga metrics na ginagamit natin, yung mga quarantine classification, yung mga strategies na ginagamit natin for the response. This is comprised of different agencies and experts, and nandyan din po yung ating faster team na gumagawa ng projections natin. So ito pong ating na i-propose would be granular lockdowns plus community quarantine, no? Yung sinasabi natin, hindi na tayo magkakaroon ng full restriction na malakihan, no? Na halimbawa it is region-wide or province-wide. Dito po sa gagawin natin na pagpapatupad, ito po ay hindi na po mas malakihan na restriction kung hindi mas magiging granular lockdown siya with sector-specific restrictions. So ibig sabihin, we give to the community, the authority, to local governments, ano yung areas na kailangang isara dahil mataas ang kaso, without having to affect the other areas na merong mabababang kaso. So pangalawa, nakita po namin, nagkaroon kami ng analysis. Ang tawag dito sa analysis is spatio-temporal analysis, kung saan tinignan po ang kalagayan ng bawat barangay sa isang area. At nakita ho natin sa pag-aaral na to, ang mga nagkakaroon ng maraming sakit or infections in a city, for example, ay halos kakaunti lang na barangay but already comprises 80% of their cases. Kaya mas lalo po naming ipinush na talagang kailangan siguro ay granular lockdown na lang para hindi naman tayo nagsasara ng husto at naapektuhan din po ang mga kababayan natin in terms of their livelihood. So ito pong lahat ay ipapatupad with sectoral specific guidelines and the community or granular lockdowns. Ito po ay ipa-finalize na namin ngayong hapon kasama po ang IATF-TWG together with MMDA, and ito po ay ipapa-aproba sa IATF officials tomorrow. So antayin lang po natin para makapagbigay kami ng full guidelines maybe by tomorrow dahil pag-uusapan pa po ito.
Thank you very much po, Yusek. Secretary Galvez said that they will ask the World Health Organization to recommend a booster for healthcare workers. Was this already discussed with the DOH, and ano na po yung mga discussions so far?
Ngayon namin ito pag-uusapan, itong recommendation coming from the vaccine cluster, katulad ng sinabi ni Secretary Galvez. So we have called on our all experts group. Ngayong 12:00 ng tanghali po ang meeting namin para mapag-usapan po itong mga rekomendasyon na to. We will give information after we get the official recommendations from our experts.
Thank you for Yusek. From Sheila, if you have the data right now, ma'am, please give us an update on the healthcare utilization rates in each of the COVID-19 referral centers nationwide.
Sheila, if we can give this in a table, we will post it in the Fiber group para hindi tayo, baka magkamali tayo sa mga numbers kasi pag sinasabi ko lang.
Thank you for Yusek. A person who got infected with COVID-19 virus was said to develop antibodies that lasts for around 6 months. Paano pag Delta variant ang naka-infect and ilang buwan daw po ang immunity?
Actually, wala namang kumpletong ebidensya ngayon kung ilang buwan nagtatagal ang mga immunity, and it varies among individuals, no? Hindi porke sinabi ni person A kung ano man ang nangyayari sa katawan ko, hindi yun exactly magiging pareho sa katawan nung katabi ko o nung kasama ko sa bahay. Iba-iba po tayo ng levels of immunity. May iba pong nagkasakit ng COVID-19 and got their antibodies, pero after a while, nag-wane na yung antibody. Pero yung iba naman, it lasts longer. Kaya we do not want to rely on this level of antibodies as of now. Ang ginagawa po natin, we just continue with what we are doing with minimum public health standards and of course vaccination. So hindi pa ho tayo nakakakuha ng sapat na ebidensya ngayon to compare immunity levels in an individual between and among the variants that we have right now. So tuloy-tuloy lang muna basta tayo dapat na proteksyonan ang ating sarili. Antayin nating lumabas ang mga kompletong ebidensya regarding all of these things. But what is important is we protect ourselves now and we protect our family.
Thank you po, Yusek. What if a person tested positive in an antigen test but turned negative in RT-PCR? Kailangan po ba niya mag-isolate?
Yes. To err on the side of caution, ayaw na nating pagdiskusyonin pa kung halimbawa nagka-negatibo pa siya na RT-PCR. Unang-una, hindi na dapat nga tinest pa ng RT-PCR dahil nag-positive na sa antigen. Ang ating guidelines, nakasaad dyan, kapag positive ka na sa antigen test, you are already confirmed positive. No need to have a repeat RT-PCR. So whenever there is a positive antigen test and then naging negative sa RT-PCR, we still go by with the first test, which is the antigen, and we isolate the person so that we can be more certain o kaya ay mas cautious tayo at wala po tayong naipahalo uli sa community na naging positive.
Thank you very much po, Yusek. May estimate daw po ba kung ilang pasyente na mild and asymptomatic ang nasa hospital at dapat na mailipat sa TTMFs? Ano po ang utilization rates ng ating TTMFs?
Ang ating mga TTMFs, mababa ang utilization. No? So pag tinignan natin across the country, nasa mga 33% lang tayo. Pero pag tinignan natin, Sheila, granularly, may mga ilang TTMFs, especially the mega TTMFs that we have here in NCR, ito mataas ang utilization, nasa mga more than 70% na ang utilization. But if you look at the different TTMFs across the country, specifically the local TTMFs, hindi siya ganun kapuno. No? So marami rin kasi sa ating mga kababayan ngayon are choosing or opting to have a home quarantine, no, instead of going to the facilities. As to the number of mild and asymptomatics in our hospital, we have about at least mga 10% pa rin among those being admitted ngayon ay mild and asymptomatic. Hindi na ganon katulad nung April and March and April na ang dami talaga, almost mga 30%. Ngayon nasa mga 10% ang na-admit pa rin na mild and asymptomatic.
Thank you po, Yusek. The DOH said last week that COVID cases may peak in mid-September. Does this projection still hold true, and what's the projected trajectory of our case counts now?
Sa ngayon, kailangan natin maintindihan. These projections are dynamic. Magbabago at magbabago yan kahit araw-araw. Dahil kasi yung ginagamit natin na assumptions dito sa projections na to, nagbabago rin siya araw-araw. Remember, our assumptions that are included in these projections includes the number of cases, number 2, yung vaccination coverage, number 3, yung shortening the duration from detection to isolation, and the 4th would be compliance to minimum public health standards. So lahat itong mga indicators na nabanggit ko, pwede yan magbago araw-araw at maaaring magbago rin yung ating assumptions at projections natin kapag ka nagkaganon. So when we say that we are projecting about 17 to 43,000 cases per day in NCR, it's not cast in stone. Okay? Pwedeng mabago, pwedeng tumaas pa, pwedeng bumaba naman kung base dun sa gagawin natin na response. Kaya nga po tayo ngayon ay nagsasabi, no, sa ating mga local governments and sa ating mga kababayan na magtulong-tulong tayo para hindi po natin maabot itong numero na sinasabi natin that will happen based on projections here in the National Capital Region. So again, let me reiterate that these projections are not cast in stone. It is updated regularly by our pastor team, our epidemiology bureau, dahil alam natin na nagbabago po talaga yan base sa numero ng kaso at doon sa ibang factors na nabanggit ko. Kasama rin po dyan sa scenarios natin kung anong klaseng community quarantine classification meron tayo, which also provides an effect, no, dito sa mga numerong sinasabi natin.
Thank you very much, Yusek from ICO. Iyong marireceive po na 808 million from DBM for healthcare workers special risk allowance. When will it be distributed sa kanila and saan-saan pong hospitals and regions particularly po ito maipamamahagi? And aside from the 311 million and 808 million, how much po ang need na maibigay at ilan pa po ang inaasahan na nating healthcare workers na dapat makatanggap ng special risk allowance?
Yes, Aiko, no? So itong sinasabing 808 million, nakapost na po doon sa DBM na website. Pero hindi pa ho namin natatanggap yung official na papel ng SARO. So hindi pa ho kami nakakapag-release hanggang sa ngayon. As soon as we get it and we receive it coming from the Department of Budget and Management, ibababa na po namin agad-agad para ma-receive naman ng aming mga regional units and hospitals, and they can immediately also disburse, no, to these specific facilities where the healthcare workers na eligible para dito sa perang to ay naandun. As to the total o kung ilan pa kailangan, sa ngayon hindi pa namin alam. Kasi remember, nung initial nag-release kami ng almost 7 billion, 300 plus thousand yan na healthcare workers, pagkatapos ang dami pang sumunod na kasi naabutan sila ng deadline noon, hindi sila nakakomplete ng requirements, pinayagan natin. Kaya nagkaroon pa tayo ng additional, di ba? Nag-umpisa sa 311 million and now it's 808 million. So nag-aantay pa rin kami ng mga final listing ng mga humahabol na healthcare workers from our regional units, and then we will know how much we still need and how many healthcare workers still are to receive their benefits from DOH.
Thank you very much, Yusek. Over 20,000 new COVID-19 cases po reported this past few days, pero may ilang laboratories po ang hindi nakakapag-submit. Kung complete po ang labs sa submission po ng data sa COVID-19 document repository system, ilan po ang expected na daily tally ng new cases?
Actually, yung sa kahapon, itong 20,000 na cases. And for the other days, kino-compute namin. And as of this September 3, 5 laboratorio ang hindi nakapag-submit ng araw na yon. Tinitignan namin yung average or yung estimated nila na output per day. And during that day, 0.9%, ang ating samples na maari na makukuha from them, 0.9% of this totality. So maliit lang po, hindi masyadong nakakaapekto. Nung ibang araw, tinignan din po natin, hindi naman masyado. Nagbibigay na kasi kami ng warning sa ating mga laboratories ngayon. So hopefully they will cooperate, and so that our numbers will be complete every day. So let me take this opportunity. Nananawagan kami sa lahat ng laboratorio na lisensyado po ng Department of Health. During this time na meron po tayong ganitong sitwasyon, sana po ay makatulong namin kayo. Please submit completely and on time ito pong ating mga laboratory results. Dahil dito po natin binabase ang numero sa bawat araw. Dito rin binabase ang mga response at aksyon na ginagawa ng gobyerno. So, Lindsay?
Thank you, ma'am. Hindi daw po binubuhos lahat ng bakuna noong March dahil tinitingnan daw po ang side effects ng vaccines. So paano daw po kung may mangyari sa kanila sa bakuna, alangan na daw pong ituloy pa. Hope the DOH can clarify this.
Matagal na po nating nasagot itong issue na to, kung bakit po in batches na bakunahan ang ating healthcare workers. Bilang paghahanda po dun sa mga mild reactions na maaring ma-experience ng ating healthcare workers, sila ay binakunahan per batch. Kung sakaling may hindi nakapasok dahil sa mild reaction, ay sigurado po na sapat naman po ang ating healthcare workers na nanatili sa ating ospital. Hindi po pwedeng sabay-sabay kasi nga po, kailangan po natin na makakapag-maintain tayo ng adequate number of healthcare workers dun sa ospital. Pero dun sa ginawa natin, this is a strategy for us to reserve or preserve yung healthcare workers na maaring magtrabaho sa ospital. Hindi po porke ginawa natin yan ay ginipig sila. Ito po ay ginawa para po kung sakaling magkakaroon sila ng mild reactions na expected naman po talaga dito sa mga bakunang ito, ay magkakaroon po tayo ng maintenance or masusustain natin ang operasyon ng ospital. Kaya po nagkaroon ng scheduling. It's not because it is just being tried to them, na try na po ito kasi binigyan na po ng EUA ang mga bakunang ito at sinabi na ng FDA ligtas yan at saka efficacious para sa ating population. So the main reason, that's why meron tayong batches of healthcare workers during that time was for us to preserve, no, or to maintain operations of the hospital if and when there would be reactions, these mild reactions among their healthcare workers during the time that they were vaccinated.
Thank you, Yusek. Yusek, I will now be going through the questions sent through our Zoom chat. From Red Mendoza, with the gradual loosening of restrictions po sa Metro Manila come September 8, ito na po ba ang sign that we have to live with the virus? And will the DOH also recommend the reopening of some high-risk industries na more than 15 months nang nagsara like video arcade centers, cinemas, and other indoor leisure activities para makagalaw ang ating ekonomiya?
Red, kailangan natin maintindihan kung bakit ito inirekomenda kasama ang DOH from the IATF Data Analytics Team. Pinag-aralan po natin ang mga kaso natin at saka mga restrictions natin for these past weeks. At nakita po natin na yung big or province-wide or region-wide na mga restrictions mukhang hindi na effective dun sa ginagawa natin response because mobility is there already. Because alam naman natin, kailangan na maghanap buhay ng mga kababayan natin. Kaya, nung tinignan natin, if we do granular lockdowns, as I've said, we had this spatio-temporal analysis kung saan ipinakita nitong analysis na to na yung mga nagkakasakit, common across the country. Yung mga nagkakasakit sa mga bawat lugar, ilang barangay lang nagko-comprise ng 80% of their cases. Samantalang yung mga ibang barangay nila, pa isa-isa lang ang kaso, padalawa-dalawa. So ang idea, bakit natin isasara ng buo kung yung mga barangay naman na yan ay maari nating ma-identify at sila ang isara lang muna natin to restrict mobility and for us to contain the transmission within those areas. Kaya po natin na-irekomenda ang granular lockdown para dito sa uumpisahan natin this proposed shift. Now, as to opening up the economy, kasama na rin yun, di ba? Because dalawa ang naging parang benepisyo niyan pag ginawa natin yan. We're not going to close a big area. We're just going to close specific small areas para naman nagtutuloy-tuloy ang buhay ng mga tao dun sa mga areas na wala naman talagang wala namang ganung kataas na kaso o pa isa-isa nga lang. At magtuloy din po sila sa kanilang hanap buhay at iba pang gawain. So, ganun po ang objective natin. Yan po ang gusto nating makita dito po sa policy shift na naipropose. But as I've said, this is still for approval from the IATF.
Thank you po, Yusek. From Caroline Bongkin, how will the granular lockdowns be effective and what is the projected number of cases if we go on a region-wide restriction like MECQ versus granular lockdowns?
Ginagawa pa lang, Caroline, yung projection natin ngayon that will include already granular lockdown restrictions. Ang atin pong objective, kaya po natin pre-propose itong granular lockdowns, would be that pag ginawa mo yung granular lockdown, mas makakagawa ka ng active case finding kung saan nagbabahay-bahay kayo at hinahanap nyo ang may sakit o kaya nagko-contact tracing kayo ng mas intensive, nakakapag-test ng mas maayos, may isolate agad yung mga taong may sakit. And of course, nandun yung mobility restriction. So when we do that, we are not affecting a very big area in our population, but we have identified the high-risk areas kung saan dapat talaga ituon ng local governments ang kanilang efforts to respond. So yan yung nakikita nating benepisyo kung bakit ito po yung gagawin natin in the coming days. But as I've said, this would still be finalized and pag-uusapan at i-approve po ng IATF.
Thank you, Yusek. From Lay Alvis, ano po ang lagay ng supply ng tocilizumab at baricitinib?
Sa ngayon, ang ating mga repurposed drugs, meron po tayo na supply ng remdesivir hanggang end of the year. Ang tocilizumab po, meron pa tayong supply, kakaunti na nga lang ngayong first week of September when we check. Some of our hospitals still has the supply of tocilizumab. Meron pong isang ine-explore na avenue ngayon ng ating gobyerno tinutulungan tayo ng private sector, yung PHAP at saka yung PPPI, na nakikipag-usap sa ibang bansa, no, ibang supplier ng tocilizumab, and hopefully mag-push through po ito para makakuha tayo ng additional supplies of tocilizumab. At as to this baricitinib, ang supply po niya ay hindi naman po nagkakaproblema sa ngayon dahil nare-replenish naman po ng kanilang manufacturer, and it has CPR kasi. So hindi natin masyadong nagkakaroon ng ganyang issues, no, with the supplies of the baricitinib. Ito lang po talagang tocilizumab because there is really global shortage of this drug. But we are trying to explore other means, no, para po tayo makakuha ng supplies na ito dito sa ating bansa.
Thank you po, Yusek. From Jessel, Ricafort, may mga nasampula na daw po ba sa pananagaan ng presyo ng tocilizumab?
Wala pa kami nakukuhang report, but we have already alerted the Philippine National Police, of course with the FDA yan, yung pang iba pa ho nating mga kasamang ahensya sa gobyerno about this SRPs natin na meron, at nakakarinig nga tayo ng talagang pagtaas na sobra ng presyo nitong gamot na ito. So hopefully in the coming days, we can be able to prevent this kind of excessive pricing para pag nakapag-monitor tayo at nakita ng mga tao yung presence natin, so that people will be dissuaded or ma-avoid nila yung pag-excessive pricing ng gamot na ito. So antayin natin, we'll give information for that.
Thank you po, Yusek. From Jessel again, Brazil suspended the use of over 12 million doses of Sinovac that were produced in an unauthorized plant. Sa atin, paano po ba tayo makasisigurado na manufactured ang mga ito sa mga authorized plants?
Meron tayong certificate of analysis, kaya nga hindi po natin ibinibigay kaagad-agad sa ating mga kababayan. Kung matatandaan nyo, ang Sinovac, dadating po yung supplies na yan dito sa ating bansa, pero hindi pa natin maibigay kasi inaantay lagi-lagi yung certificate of analysis. And that is our assurance that it came from a manufacturing plant na up to standards at par sila, pati yung mga batches ng bakuna na dumating sa atin ay siguradong of safe and it is of quality. Kaya yung certificate of analysis po ang pinangahawakan natin para dyan.
Thank you po, Yusek. Yusek, hanggang kailan daw po ang deadline ng submission ng list of SRA-eligible healthcare workers?
Nakikipag-usap tayo ngayon with the Department of Budget and Management kung hanggang kailan tayo pwedeng tumanggap ng mga eligible healthcare workers. Actually, meron din naman tayong ballpark figure as to the totality of the healthcare workers. Pinagre-reconcile lang natin ngayon ang ating mga datos dahil ito po ay estimate din. So sa ngayon po, atin pong pinag-aaralan, pero ang ginagamit po kasi natin ngayon yung ating total number na sinumite sa atin. And as I've said a while ago, as meron na tayong total pero biglang meron pa palang hindi mga nakakatanggap at nagsasubmit pa rin na patuloy sa atin. Kaya ina-accommodate pa ho natin. But as to the deadline, as to when at hanggang gaano kadami at gaano ang halaga, nakikipag-usap po tayo ngayon sa DBM as to this kind of thresholds.
Thank you, Yusek. Under granular lockdowns po, ano po ang proposal ng Department of Health and Operations of Restaurants and Personal Care Services? Papayagan na po ba ang mga ito?
May framework tayong ipapatupad dito sa ating binigay na policy shift. Yung framework ng 3Cs ay atin pong i-adapt dyan sa policy shift na yan. Yung 3Cs, yung closed areas, yung contacts, close contacts, yung areas or gatherings na makakapag-permit ng close contacts between and among individuals, at saka yung gatherings na sinasabi natin. So itong 3Cs na ito, dapat mako-comply, at yung mga areas or establishments na hindi papasok dito sa 3Cs framework, ay iyan po yung pinopropose natin na hindi muna natin bubuksan. So ito po ay isang proposal pa lang. Gusto ko lang sabihin sa inyo at ito po ay pagbibigyan pa ng approval ng IATF by tomorrow.
Thank you po, Yusek. From Jessel, clarification din po, pati ang BARM confirmed na ba na may Delta na and hindi na po yung dalawang ROFs ang pinag-uusapan?
Base dun sa last run natin, Jessa, yun pa rin, no? Wala pa rin ng BARM. Yung sa BARM kasi noon, returning overseas Filipinos. Though their addresses were in BARM, pero returning overseas Filipino sila. So hindi natin pa sila ika-classify na from BARM kasi returning overseas, ibig sabihin hindi galing sa komunidad ang ating sakit, kung hindi nanggaling po sa returning overseas Filipino. So classified as ROF but their addresses are in BARM.
Thank you po, Yusek. Mayroon daw po mga underreporting of COVID cases and deaths, and by how much? Are we seeing the same daw po?
Katulad nung lagi naman namin sinasabi, meron talaga tayong difference between the national and the local numbers. This is because of the submissions at nauuna naman talaga ang local to validate their cases. So isa yan, dun sa tinitignan nating differences. Pangalawa, meron po tayo kasi ang nire-report natin ay confirmed cases, no? So but we still have suspects and probable sa ating mga facilities and even in the communities na hindi po natin sinasama yan dun sa talaan natin kasi ayon sa classification natin based on WHO guidelines, confirmed cases po ang nire-report natin. But we still monitor the probable and the suspect cases at meron din po tayong talaan ngunit hindi po natin sinasama sa kabuoang bilang na may kaso dito sa ating bansa.
Thank you, Yusek. Given the high number of cases in the recent days, are we still expecting to see the effect of the ECQ in NCR 2 to 3 weeks after?
Kasama yan, ano? At sa tingin ko naman may epekto yan kahit sa papaano. Kaya lang, pag tinignan natin, di ba, yung ating projections nung pinakita namin sa inyo, even with ECQ for 6 weeks, yung sa isang pinakitang scenario, yung isang scenario MECQ, 4 na linggo, 2 linggong GCQ with heightened restrictions, at yung pangatlong scenario MECQ, GCQ, nakita natin pataas-pataas pa rin ang kaso kahit na meron tayong mga ECQ, MECQ. So ibig sabihin, nakokontrol man natin ang mobilization, nakokontrol man natin ang pag-interact ng mga tao, patuloy pa rin tataas ang kaso. That is the characteristic of the Delta variant. But what would be most important for us is for us to be able to maintain the severe and critical cases at that low level para hindi rin po ma-overwhelm ang ating healthcare system.
Thank you, Yusek. Karen Lema, under granular lockdowns, if approved, will there be instances where face-to-face classes will be allowed?
Isa ito, no, sa in the future, katulad ng sabi ko, ang granular lockdown, authority yan ng local government. For the national government, we will be guiding all of our local governments with sector-specific guidelines. Ang sector-specific guidelines, that can be the education sector, that can be the trade and industry where establishments are included, that can be the others, no, yung mga outdoor sports and all. Yan po yung ibibigay na guidance ng national government. Pero syempre, lahat yan base pa rin sa alert level status ng isang lugar. So yan po yung ginagawa natin at binubuong proposal ngayon. But as I've said, ipapaliwanag po namin ng buo yan. Baka bukas, no? Pagkatapos lang ma-approve ng IATF. For now, ito po ay isang proposal pa rin hanggang sa ngayon.
Thank you, Yusek. Kasama na daw po ba sa policy ang proposed vaccine bubbles? And if you have the data now, ano daw po ang status ng utilization ng oxygen and ventilators?
Yung vaccine bubbles na pinopropose, pag-uusapan pa yan sa IATF. Pero sa ngayon, ang DOH po ay may posisyon ukol dyan na ngayon pong tumataas ang kaso at nakikita ho natin na may mga breakthrough infection. So hindi pa ho namin mairerekomenda na magkaroon ng distinction between vaccinated and unvaccinated individuals. Lahat po ngayon ay dapat mag-ingat. Lahat po ngayon ay dapat sumunod pa rin sa minimum public health standards whether you are vaccinated or not. So hindi pa ho namin mabigyan ng ganyang positive recommendation yung vaccine bubble as base po sa DOH po yan na rekomendasyon sa ngayon. As to the oxygen status, we will be posting in our Viber group these details.
Thank you po, Yusek. Last question. Sa NKTI daw po, kahit magdadagdag ng tents, nakukulang din naman daw po sa manpower. How are we assisting them po?
Yes, no? So ngayon po at kinakalap po natin ang mga requirements ng ating mga ospital as to additional healthcare workers. We are tapping other national government agencies like Dati nakapagbigay na ang Bureau of Fire and Protection at PNP ng additional healthcare workers at na-deploy po natin sa mga vaccination sites, sa ating mga primary care facilities. Ngayon po humihingi tayo ng karagdagan at dito naman po ay i-deploy natin dun sa mga tents natin sa mga ospital para karagdagang workforce sa ating mga ospital.
Thank you po, Yusek. Before we officially end our media forum, do you have your final messages to our media partners and of course to our public viewers for today?
Yes, no, sa pagtatapos ng ating media forum, gusto lang ho namin muling magpasalamat sa ating mga media partners. Alam po namin patuloy nyo kaming sinusuportahan sa pagbibigay ng mahahalaga at saka wastong impormasyon ukol sa COVID-19 at sa mga bakuna. Mariin din po namin inuulit ang mga paalala upang mapigilan ang pagkalat ng COVID-19. Patuloy po ang panawagan sa ating mga local government units na mas lalo po tayo magpaigting ng ating implementation ng prevent, detect, isolate, treat, and reintegrate strategies upang patuloy po nating mapababa ang ating mga kaso sa iba't ibang lugar sa ating bansa. Nananawagan po kami sa ating mga kababayan, sumunod po tayo lahat sa minimum public health standards dahil ito po ang nagsisilbi pa ring pangunahing depensa natin laban dito sa nakakahawang Delta variant dito sa ating bansa. Piliin po natin lahat magpabakuna para sa karagdagang proteksyon at para rin po maproteksyonan nyo ang inyong pamilya, ang inyong kapitbahay at ang buong komunidad. So maraming salamat po sa inyo and we will see all of you in the coming days. Thank you, Lindsay.
Thank you very much, Yusek. Thank you very much to our media partners.